Pathology, Chapter 16, but the biological bases of behavior disorders. Maybe. There we go. According to a study by the National Institutes of Mental Health in 2005, 32.2% of the population in the United States have a psychiatric disorder sometime in their lives. That's about 1 out of every 3 people. Within any given 6-month period, 19.1% of the population suffers from a psychiatric disorder. NIH study in 2005, same one, 16.4% of the U.S. population will suffer from some form of substance abuse in their lives. 6% have suffered some form of substance abuse within any 6-month period. 13.3% of the population will suffer alcohol abuse or dependence in their lives. 4.7% have suffered alcohol abuse or dependence within 6 months. Within any 6 months. 5.9% of the U.S. population will suffer from drug abuse or dependence in their lives. 2% have suffered from some form of drug abuse or dependence within any 6-month period. 1.5% of the U.S. population will suffer from schizophrenia in their lives. 0.9% have suffered from some form of schizophrenia within any 6-month period. And as I have probably told you, I have a niece that has schizophrenia. 8.3% of the U.S. population will suffer from an affective disorder, manic or depressive episodes in their lives. 5.8% have suffered some form of affective disorder within any 6-month period. 0.8% of the U.S. population will suffer from a manic episode in their lives. 0.5% have suffered some form of manic episode within any 6-month period. 5.8% of the U.S. population will suffer from a major depressive episode in their lives. 3% have suffered some form of major depressive disorder within any 6-month period. 33% of the U.S. population will suffer from minor depression in their lives. An undisclosed number will suffer some form of minor depression within any 6-month period. 14.6% of the U.S. population will suffer from an anxiety disorder in their lives. 8.9% have suffered some form of anxiety disorder within any 6-month period. 12.5% of the U.S. population will suffer from a phobia in their lives. She has a butterfly on her head. That's the phobia. 7.7% have suffered some form of phobia within any 6-month period. 1.6% of the U.S. population will suffer from a panic disorder in their lives. 0.8% have suffered some form of panic disorder within any 6-month period. 2.5% of the U.S. population will suffer from obsessive compulsive disorder in their lives. 1.5% have suffered some form of obsessive compulsive disorder within any 6-month period. A study by Kessler and his colleagues in 1994 disclosed that almost half the population would suffer from a psychiatric disorder in their lifetime. 30% of his respondents reported a psychiatric disorder within the previous 12 months of the survey. At the turn of the 20th century, 20 to 25% of all the inhabitants of mental hospitals around the world suffered from delusions, grandiosity, and euphoria, poor judgment, impulsive and capricious behavior, and profound changes in their thought structure. In 1911, this problem was identified as syphilis. Since the development of antibiotics, the number of people suffering from paresis, which is what the symptoms are called, has been reduced to 0. And that's this. It's a spirochete. Syphilis is caused by a bacteria called Treponema pallidum. It's a spirochete, and this is what a spirochete looks like. If you have strep, this is what strep looks like. This is what beta strep group A. Staph aureus is a cocci. If you have gonorrhea, it's a diplococci. That's that one right there. If you have an enteric, a bacteria from that comes from feces, then it's a rod, and these are the rods. And I'm not sure what that is, but that's what a spirochete looks like under the microscope. I've only seen it twice. Thank goodness. Sadly, one was a baby. So, baby was born with congenital syphilis. Most psychologists consider schizophrenia the most serious of the mental disorders. Schizophrenia is known in every culture around the world. 1 to 2% of any population will suffer from symptoms of schizophrenia. Although the description of the symptoms of schizophrenia has changed over the years, the symptoms themselves have remained basically the same. There are positive symptoms and negative symptoms. Positive symptoms mean that something is added to their personality, and what is added will be hallucinations, delusions, or excited motor behavior. Negative symptoms are things that have been taken away from their personality: slow and impoverished thought and speech, emotional and social withdrawal, blunted facial expressions. Family studies, if schizophrenia is genetic, then relatives of schizophrenics should have a higher incidence of schizophrenia than the public at large. While the general population has a 1 to 2% incidence rate, parents have an incidence rate of 6%, siblings 9%, and half siblings 6%. The closer the relation, the greater the risk. And I'm going to show you what people suffering from schizophrenia look like. Maybe. There we go. And it's no longer part of that. Oh, there we go. Sorry. Family studies comparing monozygotic and dizygotic twins. Monozygotic twins had an amazing 48% incidence rate, while dizygotic twins, monozygotic means they're from the same egg, and dizygotic means they're from two different eggs. So monozygotic, 48%, almost half of them. If one of the twins is schizophrenic, the other one is schizophrenic. With dizygotic twins, it's 17% incidence rate for schizophrenia. Children of schizophrenics have a 13% incidence rate. So, work by E. Fuller Torrey has shown that when one twin is different, it is observable early in life. Research by Torrey looking at discordant monozygotic twins shows that the twin that develops a schizophrenia is the lowest birth weight and the one who is most abnormal throughout their life. And thinking of my niece who suffers from schizophrenia, it was difficult to take a picture of her where she was smiling. She usually didn't want to have her picture taken, but she never smiled. Even as a baby, she never smiled. She always looked distressed. Elaine Walker looked at monozygotic twins in a similar manner. Walker proved that even the least indoctrinated layperson could pick out the future schizophrenic twin from home movies. This they were able to do with uncanny accuracy. Work by Levy et al. In 1993 and Stuvey et al. In 1997 demonstrated that individuals suffering from schizophrenia are unable to follow a slow to and fro movement such as the pendulum of a clock. Schizophrenics tend to have their eye movements interrupted with jerky eye movements called saccades. And this is what it looks like if you and I were looking at the pendulum of a clock. We would see it moving back and forth and we could follow it with our eyes. This is what happens to somebody who has schizophrenia. They cannot focus on the pendulum. Work by Ketty and her colleagues in 1975 and again in 1994 looked at the psychiatric histories of adoptees and their biological and adoptive parents. Ketty et al. Discovered that of the adoptees who suffered from schizophrenia, the biological parents were far more likely to suffer from schizophrenia than the adoptive parents. And I'm guessing I was wrong. Ketty is a male, and that's him right there. Combining the twin families and adoptee studies, many researchers have concluded that there is a genetic factor in schizophrenia that is inheritable. What structure is being inherited, what structures are involved, which genes are being inherited, and what processes do they control? While autopsies often found enlarged ventricles on people, ventricles are the open areas of your brain. People suffering from schizophrenia, it wasn't until the brain imaging techniques, CAT scans, and MRIs, that this was confirmed in living patients at all stages of the disease. There's always a question if an effect is caused by the disease or the effects of the disease, dietary limitations, prolonged stress, the toxic effects of antipsychotic drugs. And that's what we're talking about. These are ventricles. That's a ventricle. This is a ventricle. That's a ventricle. There's a ventricle that runs this way, but it's difficult to see. But as you can see, these are much larger. These, and you can see this one down here is much larger. The more advanced the case, the greater the enlargement of the ventricles. The larger the ventricles, the poorer the response to antipsychotic drugs. Research has also shown that the lateral ventricles tend to be the most likely to be affected, and these are the lateral ventricles. Discordant twin studies where one twin has schizophrenia and the other doesn't showed that in 75% of the cases, the hippocampus and the amygdala were smaller in the schizophrenic twin. Researchers speculate that the enlarged ventricles and smaller brain structures denotes atrophy of neural tissue. Looking deeper into the hippocampus, researchers have discovered that the pyramidal cells of people suffering from schizophrenia are disorganized in the sufferer as compared to the normal individual. The degree of disorganization relates directly to the severity of the disorder. This is what it normally looks like. As you can see, it's very columnar, everything is in a line, and this is somebody suffering from schizophrenia. You can see how disorganized it is. And that's what we just saw. And this is the area that we're talking about. This is one of the reasons that memory is all messed up. And if you talk to somebody with schizophrenia, they'll go from one subject to the next. One sentence will be about one thing, the next sentence will be about something totally different. And this is why, when they're trying to remember things, this is how they're remembering things. This is how you and I do it. That's how we can keep an idea in our minds, but the schizophrenic has a very difficult time. Machon and her colleagues speculate that this derangement of the hippocampal pyramidal cells occurs due to maternal exposure to the influenza virus during the second trimester of pregnancy. That's when the brain is developing the most. So if the mother has the flu during the second trimester, then this can be a problem for the baby. So if she had the flu season runs from October through January. That means that children born in the spring are more likely to have schizophrenia than children born in the fall or children born in the summer. And I have a sister born in February. Wait a minute, let me think about this for a second. When was her second trimester? February, January, December. So she was right there. She's a little goofy, but she's not schizophrenic. Looking at blood flow in the brain during the resting state, researchers have discovered that in the brain of schizophrenia sufferers, the left hemisphere is more active than the right hemisphere in the frontal lobe. PET scans indicate that people suffering from schizophrenia have less metabolic activity in the frontal lobe to begin with. And this is a normal control, and this is somebody with schizophrenia. You can see that their brains are going all the time at a lower level, of course. Much of the proof that dopamine is a neurotransmitter that is the cause of symptoms of schizophrenia comes from pharmacological studies. Tens of thousands of schizophrenia sufferers were able to leave psychiatric hospitals when chlorpromazine was discovered. Chlorpromazine and the phenothiazines block D2 type receptor sites, and that's why they assumed that dopamine had something to do with schizophrenia. Due to the pharmacological evidence, it seems that the effectiveness of the antipsychotic agents is directly related to the magnitude of postsynaptic receptor blockade of dopamine sites. Parkinson's disease is caused by the degeneration of the nerve cells in the substantia nigra, which contain dopamine. When a patient is given too much L-DOPA to compensate for the lost dopamine, they develop schizophrenic type symptoms. Some schizophrenic patients will develop Parkinsonian type symptoms if over-medicated with phenothiazines. However, some schizophrenia sufferers treated with dopamine inhibitors do not respond. Recently, a new generation of antipsychotics have been developed that do not affect most dopamine levels, and they work. These new drugs are referred to as atypical, and these are the atypical drugs: Zyprexa, Seroquel, Abilify, and Risperidol. Clozapine is an atypical antipsychotic drug that not only blocks dopamine receptors, but serotonin receptors as well. Clozapine actually seems to increase dopamine reception in the frontal cortex. One theory about the development of schizophrenia is that select chemicals build up or are created in the brain that causes psychosis. These substances are referred to as psychotogens, literally brain monsters. One theory is that an addition of a methyl group to the brain chemistry can cause a conversion of the normal compounds known as hallucinogenic agents. This is known as transmethylation hypothesis or methyl crossing process. The psychobiological model of schizophrenia emphasizes that there may be several factors interacting that cause schizophrenia. Each life phase of brain development provides potential triggers to the development of schizophrenia. People genetically predisposed with brain abnormalities may or may not experience the proper triggers in the correct sequence to create the conditions for schizophrenia. Viral illnesses such as influenza and inoculations may be part of the trigger. The stress of urban life as compared to rural life shows that more people per capita have schizophrenia in urban settings compared to rural settings. Thus, schizophrenia may emerge when the combination of life stressors are added to the neurological triggers and the genetic brain abnormalities. Autism is a lifelong developmental disorder. It's characterized by impaired social interaction, impaired language, a narrow range of interests and activities. They may perseverate. It's a word that comes from persevere, such as head nodding and ritualized finger movements. That's what's going on with this kid. He's putting his hands together. They have difficulty judging other people's thoughts and feelings. Autism seems to have a strong heritability. It occurs in 1 to 2 children per 1,000. It is far more common in males than in females. A study by Rodier in 2000 demonstrated a common abnormal allele in the Hox gene of the 7th chromosome. Reduced size of the corpus callosum, reduced size in select cerebellar regions. Reduce of the corpus callosum in autism, and this is it right here. That's a normal, that's a normal one. While periods of unhappiness affect everyone from time to time, prolonged chronic depression occurs most often in people over 40, and women 2 to 3 times more frequently than men. Depression is not sadness, but is characterized by unhappy moods, loss of interest, energy, and appetite, Difficulty in concentration, restless agitation. Depression may not be triggered by any apparent stress. Without treatment, it may last for months. Depression may afflict 13 to 20% of the population at any one time. Bipolar disorder is diagnosed when someone who suffers from depression also displays episodes of excessively expansive moods, which include sustained overactivity, talkativeness, increased energy, and strange grandiosity. And let's see if this one works. Maybe. There we go.
Federal agencies urge every family to have an emergency radio. During any
Bipolar disorder seems to get a bad rep, but a lot of people in the public eye have come forward and bravely discussed their struggles with the condition. So what exactly is bipolar disorder? Hey guys, Julia here for D News. If you're as big of a fan of Demi Lovato as I am, you know the confident singer is an outspoken activist for mental health issues. Several years ago, she came forward and admitted to her own struggles with bipolar disorder, formerly known as manic depression. Even as the disorder becomes more of a focus in the public eye, a lot is still misunderstood. Bipolar disorder is most known for the way it affects people's moods. It often creates an uncontrollable change in moods that can impact daily life for the 3% of Americans with the condition. While researchers aren't sure what causes it, the risk factors for bipolar include genetics and environment, things like stress, substance abuse, and even lack of sleep. But really, it can affect anybody. What a lot of people don't understand is that bipolar is more than just a single diagnosis. There are different categories, almost a scale of bipolar disorder. The symptoms vary from person to person. Some people's manic episodes leave them feeling exuberant and energetic. They feel really creative, like their brain is working faster than usual. This is usually less severe than mania and is classified as hypomania. In others, mania can make them go without sleep for 3 days or gamble away all their savings. There's type 1, which is what most people think of when they think of the disorder. Its symptoms include extreme manic episodes in which someone acts more erratic than usual. They have grandiose ideas, an exaggerated sense of importance and skills, higher sex drive, and higher impulsivity. While the highs are really high, the lows are just as extreme. People with type 1 have periods of extreme depression too. Bipolar 2 is similar to type 1, but low moods tend to dominate with less frequent episodes of less extreme hypomania. Rapid cycling, just like it sounds, is when someone goes through 4 or more periods of manic or depressive episodes in a 12-month period. Yet another type of bipolar disorder is cyclothymic, which has several less extreme manic episodes and less extreme depression. But no matter what type, bipolar disorder is mostly characterized by the swinging of moods from low to high. Sometimes these moods can last for weeks or months, other times they're as short as days. And to some, you would think the high episodes sound great. Who wouldn't want to feel important, smart, and driven with a flight of ideas? It's these kind of moments that make creative people with the disorder so productive. Many creative types, painters, writers, even actors have been diagnosed with some type of bipolar disorder. I've talked about this link before in another episode, but like I said, there's a downside too. Sometimes those grand ideas include delusions, like taking over the government or winning the jackpot at poker. Both the highs and lows can be very disruptive to someone's life. One study published in the journal Nature found that some people with bipolar disorder are more sensitive. Essentially, their brains are literally more sensitive to stimuli than others. In the study, researchers took skin cells from participants, turned them into stem cells, then coaxed them into becoming neurons. They found that some people's neurons are physically more sensitive and stimulated than others. Other imaging studies found differences in the brains of those with bipolar disorder. One study published in the journal Molecular Psychiatry found differences in white matter and in the cerebellum. The researchers used an MRI technique that searches for signatures of certain byproducts of cell metabolism. This technique found higher readings of white matter in the cerebellum in those with bipolar disorder than those without the condition. The research also found that there were no differences in the cerebellum in those participants with bipolar who were taking a common form of treatment for the condition called lithium. Lithium is just one of several effective treatment options, like other mood stabilizers, including valproate. According to a review published in the journal Current Opinion in Psychiatry, even some anti-seizure medications have been shown to be effective in treating the condition. Beyond medication, different types of therapy help, like cognitive behavior therapy, which helps patients build a toolkit of sorts for dealing with dysfunctions in thought patterns and information processing, or interpersonal and social rhythm therapy, which helps patients figure out how their routine and social situations affect their moods. Many people with bipolar disorder go on to live wonderful, healthy lives, but it starts with getting help. Check out resources like the Depression and Bipolar Support Alliance at dbsalliance.org. Art and creative outlets also help many people with psychological conditions heal. But what is the link between creativity and mental illness? Find out more in this episode right here. Some studies find a higher incidence of mental disorders in those in creative fields, and especially in those individuals who've reached some notoriety or eminence. Other studies find a higher incidence of mental disorders in the family members of creative people. These results strongly hint at a genetic link. So do you have any other questions about psychology or the way our brains work? Let us know down in the comments below. Don't forget to hit those like and subscribe buttons and keep coming back to D News so you don't miss a single episode.
Yay! Okay, there you go. Oops. Depression, of course, may lead to suicide. Estimates are that 80% of the people who commit suicide are profoundly depressed. While suicide rates overall are decreasing in the Western Hemisphere, disturbing indications are that suicide in the younger population is increasing. Increased use of drugs among youth may be causing the suicides. Looking at concordant studies, the incidence of depression is much higher among dizygotic as monozygotic twins. And of course, these are I can't remember their names. Anyway, they're the kids that were on Family, something about the family. Anyway, concordant, you can see they're depressed. Concordant studies of monozygotic twins raised apart shows equally similar results. These studies point to strong heritability of depression. Depression is common in select medical conditions, especially those that involve the endocrine system and brain disorders. Cushing syndrome is caused by lesions on the pituitary gland that cause an excess amount of ACTH and hence cortisol. The first symptom is depression, followed by obesity, unusual growth and distribution of body hair. And this is a lady who suffers from Cushing syndrome. As you can see, this is what she looked like, and then she started gaining weight from the Cushing syndrome. Parkinson's disease, 50% of the people who suffer from Parkinson's disease suffer from depression that can be attributed to no other symptom. This may be due to lowered levels of serotonin from loss of neurons in the dorsal raphe nucleus, where large amounts of serotonin are stored. Risperidone, a drug that increases monoamine oxidase and thus depletes serotonin and norepinephrine, causes profound depression. Some researchers have looked at these effects and point to increases in monoamine oxidase as the cause of depression. Electroconvulsive therapy also reduces depression by reducing biogenic amines. All around the world, more women than men suffer from depression at a rate at or near 2 to 1. Several interesting studies show that rates may actually be closer to the same for men and women. A study of depression rates among Amish shows men and women with similar rates. What is the intervening variable? Amish men do not drink alcohol. Men are more likely to self-medicate with alcohol than women. And actually, I just discovered that this is the growth pattern that Amish men have to wear. As you can see, they grow beards with no mustache. And that's the pattern that Amish men grow. Unlike this guy, obviously not Amish. Sleep studies of depressed patients shows that people suffering from depression spend much more time in stages 1 and 2 and much less time in the more restful stages of 3 and 4. This means that depressed people jump into REM episodes much earlier than people with normal sleep patterns. REM sleep seems more intense for the depressed. Studies show that the shorter the time it takes to go into REM, the more severe the depression. One of the effects of antidepressant monoamine oxidase inhibitors is the fact that it reduces REM sleep. Research by Ontiveros and his colleagues found that 40% of the people they tested had abnormalities in their temporal lobes. Even in a resting state, these individuals have increased activity in the hippocampal area, an area known to induce fear when stimulated. The most common treatment of anxiety is the pharmaceutical benzodiazepine, such as diazepam or Valium. Benzodiazepine works because it changes the permeability of neural membranes to chloride ions, especially those that react to GABA. Reducing your increase of GABA decreases your anxiety. The influx of chloride ions inhibits the firing of the neuron, and therefore you're better off. Studies of individuals suffering from PTSD have shown that on the average, their right hippocampi are 8% smaller than people without PTSD. High levels of circulating glucocorticoids from the chronic and intense stress of PTSD may have caused cell loss in the hippocampus. Research looking at obsessive-compulsive disorder has found that sufferers have increased metabolic activity in the caudate nucleus, the left orbital gyrus, and the left anterior cingulate cortex, and the bilateral orbitofrontal cortex. Increased serotonin levels decrease obsessive-compulsive disordered symptoms, especially the tricyclic and clomipramine. The tricyclic drugs is what that's supposed to say. Tricyclics are an antidepressant. Tourette syndrome is a tic disorder. These individuals seem to be unable to stop themselves from motor tics, vocal tics, and compulsive actions. The average age of onset is 6 to 7. These children may also have problems with ADHD and OCD. There is a single gene that may cause the problem. Concordance rates of monozygotic twins is 53 to 77%. Indications are that dopamine receptors, D2 sites, are more sensitive to these individuals, causing involuntary movements. Mad cow's disease, bovine spongiform encephalopathy, causes a wasting away of the brain tissue. It's caused by a mutated protein called prions. This is what a normal brain looks like. This is what a brain that is suffering from bovine spongiform encephalopathy looks like. As you can see, it's got holes in it. It's got empty spaces. And it's because the protein has been replaced by the prions. And that is the end of the chapter.